Good afternoon, everybody. It's Michael Dersham, of course, aka Dersh, again with our Opinions X Spaces from Apierion. Glad that everybody was able to make it today. And I guess I should say good day instead of good afternoon for those of you that are in other places around the globe other than Bermuda. Today, we're going to talk about some of the global healthcare ills and how Diaspora can play a role in meeting some of those challenges going forward. As you know, our opinion pieces, we reach out to some of the best and brightest minds around the globe to talk about some of these issues and bring them to light. And today, I am more than delighted to introduce everybody to probably two of the smartest, most strategic thinkers in the space. I'd like to say that old phrase, a rose between two thorns, but I think in this case it's a thorn between two roses. First, we have Sonia Singh. She's Chief Insight Officer of Avia Health. And also joining us, we have Dr. Sabine Kapasi, who's an advisor and leads up global strategy for the United Nations and WHO, and also is the founder and CEO of Enra Consulting out of India. So with that, if you wouldn't mind just giving a little bit of background on yourselves, Sonia, if you'd like to go first, and then we'll jump right in.
Yeah, great to be here. And Dersh, thank you for that kind introduction. Sonia Singh, as Dersh said, Chief Insights Officer at Avia Health. In my role, I work with over 50 health systems around the country, really thinking about how digital and new technologies can really reinvent how patients access care, new care models, and even operational transformation for hospital systems. As we know, there's challenges, even if you just look at the US healthcare system, there's challenges from a financial sustainability, access standpoint, and we know technology can really play a very distinctive role there. And then relevant to this call, I'm part of the Indian diaspora myself, having left India about 20 years ago and then part of the broader diaspora here. So it's a really interesting topic and close to my heart. So glad we're having this discussion.
Thank you, Sonia. Dr. Sabine, would you mind giving some of your background? And please keep it to 30 seconds because I know you, with all the background that you have, you could go on for hours, which would be enjoyable, but with respect to the time of everybody. Just kidding,
You're far too kind, and also me, at the same time. No, thank you so much, Darsh, for having me here. So I'm Dr. Sabine Kapasi. I am a surgeon by profession, which is surprising because these days I seem to do everything but. Worked in global health for about 18 years now. Wow, time flies fast, isn't it? But been with WHO international programs, with UNDAC on risk reduction for global health emergencies, and worked in about 173 countries on almost as many programs. So been around the block, seen quite a few ecosystems evolving and forming, and also how massive shifts with time and technology has shaped these systems. Also, I believe that brings about a slightly clearer picture on what it should be like, and looking at gaps from both a macro micro perspective. So I believe that that's what I bring to the table. And along with that, as Sonia mentioned, I'm also from the Indian origin, though I have been out and about for about as many, almost 20 odd years, and looking to now give back to the society that we are a part of. So, and Darsh providing that platform is amazing. So thank you so much.
You know I always am like that, Sabine. So let's talk about. So I think let me just level set kind of our definition of diaspora for those in the audience who may have not a background on how we would talk about this, and then dive into some of the challenges. Even though today we're going to talk more specifically about India diaspora, and use that as an example or possible blueprint as we look at others, whether it be African diaspora and others. So correct me if I'm wrong, Sonia and Sabine, but I guess we look at diaspora as in its basic definition of people who have spread or dispersed from their homeland, and I think that's a good basic understanding. Just like Sonia said, she grew up in India and is now in the U.S. And so if we can kind of just agree that that's just a kind of base level of what we're going to talk about as it relates to the subject, and then moving to some of the global healthcare ills, because when I think about diaspora, there's extremely positive impacts that it has, when that population goes outside their country, and when there's multiple examples of that. But also, what's the impact? I think that's what we're going to drive to today. What's the impact on those home countries and those home regions, and how this is there a model, or is there a way and a pathway forward where both receiving and sending can benefit? When I think about global health, and you guys, we've talked about this in the past. And I think COVID really exposed, even though it was tough for everybody, I think if there's one thing that I think can be positive coming out of that, is that it exposed these ills in the global healthcare when it relates to access, when it relates to inequities, when it relates to the digital divide, the sharing of resources, all of that, which, they may have spoken about in some of those dark places and knew about it, but now that it's exposed, what steps are needed, either from a public policy perspective, private sector perspective, and even individual and foundation support, to try to break through some of those challenges. Sabine, with your background with the UN and the WHO, especially within your expanded region within India, what are in your mind? What are the things that you guys talk about? What are the things that come to mind that are real challenges?
So let me talk about both the challenges and the opportunities. So India has two kinds of diaspora today. I mean, and because we are talking about the Indian diaspora, let me elaborate on that bit a little bit. So one is a diaspora of a sheer brute workforce, right? Skilled, semi-skilled workforce who go out largely for a better prospect, and that's precisely the lookout that they look for. And this was the journey of India about 35 years ago, when India did not go through the whole process of liberalization that happened in 1991. So before that, opportunities were very limited, and most people who migrated out, even though they were educated, they saw a country in need, and they were basically trying to go for a better prospect. Now, switch to today, Indian diaspora has a completely different meaning to it. So if you look at it, I mean, you and I were recently speaking about it, in the GCC region, almost all large healthcare ecosystems are being hemmed by either Indians or doctors of Indian origin. So, I mean, within the healthcare ecosystem, the nature of health education has been phenomenally good in India by the luck of sheer numbers, right? I still remember those nights in a labor room where I delivered 30 normal vaginal deliveries in one night, 30 deliveries, one doctor. So it's crazy the kind of exposure that you get with the number of people that need your help. So I believe that those kind of specialized diaspora build out has now developed in the last 25 odd years. And they have a significant power both in terms of information, social political standing, as well as financial control enough to give back both in terms of technology and in terms of knowledge to the root that is India as a country at the moment. So I think that needs to be looked at from both these perspectives, and both of them have significant ways that they can connect and deliver value to each other. So I think that's my 2 cents.
Yeah. I mean, I get that, and we can throw around, that phrase, give back, and there's organizations that, but I think, when we look at things, again in India, and Sonia, you and I talked about this, when we see that migration that's happening from the rural areas, and it's not unique to India, but talking specifically about it, where we see that migration from the rural areas to the urban areas, and those health access points in the rural areas, which were already challenged, are even more so now because there's not that population that's able to support those health systems. So I have that on one side as I give some, just thinking about this, and then I think about that part of the diaspora that Sabine was talking about, that come from India and come to the States, go to the UAE, go to Saudi, whatever those positions are. I mean, you have 35 million people that have left India, from a diaspora standpoint. You have 5 million in the United States. You have 70 to 80,000 trained physicians in the U.S. that have left India. So putting those two things together, where we have this lack of access, and yet we have 70,000, that have come to the U.S., which is an important part of the delivery system now in the U.S. It's a very important part in the UK, and the NIH. These are important skill sets, but yet at the same time, you have to face reality that it's left some part. I wouldn't call it a vacuum, but has left at least a partial void in some of these areas, especially where we've had this migration and lack of healthcare access is quite evident. Sonia, any thoughts around that stuff that I just put in the ninja blender for you?
Yeah, I think more of an emphasis of some of the things that both of you have said. One, want to put an exclamation point on the value of the health education and medical education in India, and is as you said, the sheer numbers. I think people are just the skill set is just so important, and Darsh, I would say yes, we've been talking about physicians, but let's not discount the number of nurses that India has sent to all over the world. US,
100%, right.
Australia. There's a huge Indian nurse population across the globe. Again, with that really valued education that they got in India, again through those sheer numbers. and then also the educators, the researchers. I think there's just incredible talent that is supporting the world. And I would add to that another category that I've been thinking about lately is, we often think about Indian diaspora as the two big categories of professions is medical and then technology. And I'm seeing more and more of a blend of technology and health, particularly in my purview of digital health. We are seeing so many digital health companies, and I am often struck by how many of those digital health companies are led, co-founded, or by an Indian person as well. So I think there's this blend of knowing medicine, having a passion for healthcare, and then this bringing the technology prowess to solve critical problems there as well. So want to acknowledge just how impressive the diaspora is, but it does raise the question of what are the gaps or opportunities left in India, particularly in rural settings. And I'm sure Dr. Sabine can opine on this the best. But I'm also very curious, Sabine, as you talk about where you see the gaps in India, but also how do we balance that with the innovation that's happening in India as well. In the last couple of decades, there's been so much as grassroots innovation across so many fields that is happening within India by people who are still living and developing in India.
I think that you're right, Darsh, when you mentioned that there is a gap when education systems are generally built to service their own population. And sometimes even those completely are not sufficient. And then when there is migration of talent, then of course there is a gap that is created. So the doctor to patient ratios are a little bit off today. But I believe, Sonia, as you mentioned, there is grassroots adoption of large-scale technical solutions, like the payment revolution that rocked India in the last 5 years. Today, everyone in India is on digital payment systems. Like you really don't see cash moving around in the system. Similarly, digital health has also had a lot of uptake. So, I mean, and there were lots of champions like Dr. Agrawal and others in this space, but you would not believe the ease with which digital uh, consultations and digital technology has been adopted within the, at least the outreach side of the healthcare ecosystem, if not within the hospital healthcare ecosystem. So there has been definite love for technology that is now spread to the healthcare sector very efficiently, and I believe that is being instrumental in slowly looking at bridging the gaps that existed earlier. And today, I mean, yes, there are lots of things. So one of the things that India lacks on many fronts is processes. So we have leapfrogged on a lot of things, and there are processes that have not always been followed. In India, we call that jugaad. So it has its pros and cons, right?
Don't get me started on that process in India.
Yeah. No, that's I and Darsh, have had long stories about it. But I think, I mean, it has its own space. It's this creative way of thinking, innovation, but it's also extremely disruptive. And sometimes research and processes do have their own valid space in the system. So I think one of the things that is happening today is there is digital adoption in the healthcare space, but most of the things are basically just being shared on WhatsApp, and most of the things, there are video calls happening on WhatsApp. There is very little security of information, which right now seems okay to people because they haven't seen the other side of the matter.
Right.
But as all of us who know how bad can it go, I think the systems that we are talking about and building are of extreme impute to solve the problem before it starts. Because if it does, then it's going to be out of control with a population this size. So yeah.
So I think that's pretty interesting, Sabine. Especially when you said, how can we solve it before it starts? There's a lot there, especially when we look at the technology side of it. I mean, we can say things like, okay, we have issues with recruitment and onboarding. We need more training. We need to do more capacity building because of this. We need better monitoring, data collection. All of those are, I guess, nice buzz areas to talk about. But even when I look at something like telemedicine, and India's, is, I would say, a leader in telemedicine, but particularly trying to reach those rural areas. So back to if we can, even from a preventive and clinical standpoint, if we can get ahead of that by using some of these tools and digital assets that are being created around blockchain, especially now with AI, what role can they play to create, no pun intended, but preventive medicine around a number of these issues, that we can get ahead of it and using those tools in a smart way. Sonia?
Sonia?
Yeah, I like the thread both of you are pulling on of there is the appetite for the Indian customer, healthcare user, patient to use technology, and I see that across all demographic groups, right? It's not just young people. It's getting adopted, just being able to use. I think the digital payments system has created that adoption across all different groups, which is good. I think that's a key factor to broader adoption. I think there's, just as you said, Darsh, there's so much potential with all the different digital options to improve access, to create new care models. One, because there is adoption. Two, I think India does lend itself to using these technologies differently. But I also, I think, want to underscore what Sabine said of, yes, we're sort of doing it in a very scrappy way right now, and we can get quick adoption, but how do we really think about what is a sustainable, systematic way for this to be adopted and put in place and implemented across broader scale, across different communities, districts, systems, etc. in India. And I think that's where you need to be a lot more thoughtful than just the WhatsApp way to put in place some of that infrastructure. So it seems to me like that's the next big challenge ahead.
I think you're right, Sonia. I think that if you want to call it the digital plumbing, or the plumbing that has to happen for these, and what I mean by plumbing, I'm saying not only the technology around it, but also you have to think about the regulatory environment, the cyber risk and cyber opportunity around this stuff. Again, as that data is flowing, we've talked about this time and time again. Yeah. You could do a telemedicine call on a cardiac consult from whatever, from University of Pennsylvania Hospital, to a rural area in Maharashtra, and that's great. You could Zoom that, you could WhatsApp it, but at the end of the day, there's a lot of other things that we need to have in place to create this pathway where care has no borders, where providers can provide capacity no matter where they sit. And I think when I'm really kind of trying to whiteboard and talk about it, without that, that fundamental fabric that brings that together, and then the engagement and adoption and the credibility, that's what I think we have to really focus on. And I don't want to talk about it where, geez, there's, it sounds like we have to boil the ocean to get there, right? And I say, no, let's find that initial pathway where we can create, that digital pipe that satisfies these things. Where is that? And then once we de-risk it, move that across with a swiftness, which I think then, the diaspora can come into play, because now that framework is built. And does that make any logical sense, Sabine? And I know you say no to me enough. You're the but
I might
like we say, no, Dersh, you're either way out of your stop thinking. But no, is that something? Are we thinking about it in the right direction from your perspective?
No, I agree with you. See, I think, as I said, that there are certain problems that need to be solved and thought about before they come to picture. For one of that is data security in here, right? I mean, I have been a practicing doctor for as many years, and I've seen the times when we used to carry these massive, massive medical dictionaries and stuff on our backs, like, literally, because like I used to have these cervical pains because of it, and then suddenly there was this flip phone which had a medical dictionary. So I saw that age, right? Things just starting out, and now the kind of data that we see in the e-commerce space and the way human behavior changes because of targeting only through these systems. We need to ensure that similar behavioral changes, which are targeted just because of external gathered information, does not happen in the healthcare space. So I think building those pipelines, as Darshu said, is extremely important, especially for people who suffer or are on the other end of information disparity. So you,
Yeah.
I, and I think most of the listeners here, we are all very lucky to have had some level of basic understanding of what we are talking about. But most of the people that we serve, these people are generally not as well equipped with that information. So creating ecosystems that protect their interest is of extreme importance. One. Second is, as you were saying, that once we build it, then of course there are, opening up the not just Indian diaspora as such, right? We have talked about, and we have actually executed solutions in North African region and in right now in regions like Yemen and others, which have been extremely war-torn for a very long time. And we have bought doctors globally who can service those who have similar cultural heritage, who have similar understanding of the population in the region. And I think that once the ecosystem is built, these two-way bridges and opening up that for the global ecosystem to contribute within any region is going to be something of a next step, which I believe if we can be a part of that would be massive, because we are talking about doctors, nurses, as Sonia you mentioned, and others who have now had global exposure to be able to contribute in education, in case to case basis, as well as in direct patient care. Because one of the things I believe that systems like the ones we're talking about can also empower is global licensing systems that can actually have very quick parity across different geographies. So I think creating data security, creating global licensing systems, and then opening it up for use and support to populations that need it is going to be a fascinating journey to work on.
Yeah, I
Well
think
said.
we're within that era of, I think before, to do something like this, you had to physically move people. You had to have the time commitment of, physicians or nurses to take a sabbatical, go to another country, do Doctors Without Borders and things like that. And there's always going to be a need for that on.
And didn't we all do that, right?
Yeah.
I mean,
Yeah, and there's always going to be some need for that, but I think it's a new way of solving similar problems where we use technology, new capabilities, new paradigms to say, let's still connect people, people in need with people who have skill sets and services, but without actually having to move humans across the globe. This actually creates a accessible way, not just for people in need, the patients who need it, but also people who want to contribute. They don't have to leave their job. They don't have to leave their families and move across the globe. They can still contribute in a way that is accessible. So it makes it easy for, multiple parties to be part of this ecosystem, as you described.
No, that's great. So we just have a couple minutes left. So with that, let's stress that within the next 120 seconds, we solve this challenge, okay? Which I'm confident with the two of you, we can do that now in 110 seconds. Now, in all seriousness, any parting things? How do we get started? What's the first thing that comes to mind as we close out this opinion piece?
Some thoughts. I think one.
Sonia, why don't you go?
Yeah, I think this vision that we have described over here is really compelling to me, and I can see how this can be compelling to the broader diaspora. I think it solves one very important intangible needs. So it isn't just a nice to have. And I think we need to start putting some plans in place to start to try it out and do it small, but move fast. And we'll learn along the way as we start to do that before we start. As you said, we don't want to boil the ocean from the get-go, but want to start with quick wins, learn quickly, and move fast.
Well said. Sabine?
Yeah, I think that, we are talking about a dream or vision which results in public good. As a doctor, I think that's something that is something I'm most invested in. So, I mean, we really don't have time to waste anymore, not just from the Indian context, but building these frameworks as technology. Let's build that community and start building people in, because we are already there. We already need that, and the time is right at the moment. I mean, any later would be a little too late. So no time to waste. Let's go.
Yeah, and I think just to your point, Sabine, it's not an option. It's not an option. It's got to be.
It's not. It's really not.
Yeah. Well, with that, thank you, Sonia. Thank you, Sabine. To be continued. I don't think we did it in the last 120 seconds, but yeah, looking forward to having you both back on again and continue this discussion, as well as for the broader community. Keep your eyes peeled for our next edition of Opinions over the next couple of weeks. Thank you all.